Hello, Dr. Scott Hernandez from Kai Fitness. I have been asked a lot of times to explain further about my philosophy and why I train the way I do. Like I said in the intro, if you watch my video, I've been a chiropractor for 20 years. Graduated Life University in 2001. And I did practice in a high volume practice several years before I realized there was a commonality to people that were basically working out and strengthening their core via Pilates or via a good trainer that was teaching them how to train core properly. And I noticed that those people needed less and less adjustments because a lot of spinal adjustments are given to unstable segments. And so those people never really feel the full benefit of chiropractic in doing a rehabilitation or a corrective exercise program after getting adjusted. So after finding out that my patient base was getting better faster by doing core exercises, I decided to follow some of the experts in my profession. One of them is Craig Liebenson. He's a chiropractor, but he's a specialist in corrective exercise and rehabilitation out of LA Sport and Spine. I don't work with Dr. Liebenson. However, I've read several of his textbooks, and this is one of my favorite. If you're a trainer out there, or if you have a huge interest and understand some medical terminology, or if you're a personal trainer, physical therapist, and you do not have this book and you're teaching exercise, you're doing your patient a disservice. You should really, really look at your client base and see all the injuries and how you can prevent them by getting educated on proper form, and proper programming is even more important. So I want to go into a little segment on this subject by first explaining to you how do you know if you're doing a good program for yourself? Well, if you're doing an exercise and you have some pain in a joint while doing that exercise and you don't understand where your pain is coming from or how to address the pain, then you're basically working through something that's actually going to become a very chronic injury. Because you're not understanding that what you're doing is actually making the problem worse. I know I've had trainers in gyms that I've worked with tell people, well, just keep doing squats. If your knee hurts, and it'll eventually get better. Well, that might be true in the younger population or the athletic population where the body can kind of fix a lot of its own problems. But in the older population, over the age of 35 even, I don't see that at all. I see people coming in from personal trainers that injured them and they didn't recognize their injury. No fault to the trainer. Some trainers are not educated in this, so you can't blame the trainers. However, if you're paying good money for your training program and you don't understand how to get around these injuries, or you're not getting educated properly, then you're probably gonna end up injured. So if you wanna know more about how to correct some of these injuries, click on some of my specific videos. So if I say shoulder dysfunction, I'll call it, so we don't look like we're treating disease. We're treating a dysfunction or a disease in the joint, an imbalance in the joint. So I'll help you guys figure out when it's serious and when it's not so serious, and how to work around it, and how to add exercises to your program that help you fix some of these injuries on your own. Okay, so let's get started with that exercise series. So if you see a shoulder video, go ahead and click on that and I'll explain. If you see a hip video or a core video or low back pain video, click on those accordingly. And you're gonna learn more about your body and how it works. I look forward to helping you guys. Scott Hernandez, chiropractic physician, personal trainer, owner of Kai Fitness, and our philosophies are gonna be a lot different than a lot of trainers. So follow along, understand the science, and I'll make it as easy as possible to understand. Have a happy and healthy day, and I hope everybody's doing well. Take care.